Let's talk to Peter Openshaw. He is a professor of experimental medicine at Imperial College London. Good afternoon to you, sir, and thank you very much for joining us.
Good afternoon.
First of all, can I get your reaction to these sweeping border closures? Given that we understand this strain has been in circulation for several months in the UK, isn't it quite likely to be already widespread on the continent?
I do think it is quite likely that this virus is going to be picked up elsewhere. I should emphasize that it's only by going back through the samples that it's been possible to identify that it has been around for several months. It was really only on the radar as a potential threat in the past couple of weeks, really. And it was only at a meeting of NERVTAG just at the end of last week that we really reviewed all the new evidence that we had and recommended that action should be taken at that point. So I think it would be wrong to think that we've been sitting on information for a long time, and I do think it is quite likely that this new variant is spread because it's so much more transmissible.
70% more transmissible, in fact. And I wonder how you think the public should understand that increased transmissibility. Should the public change their behaviour, perhaps? In your view, are barrier measures like masks and social distancing perhaps not effective enough to combat this new, particularly aggressive strain?
I think these measures do work. We know that they work, and they should work against this new variant if they're well observed. I think the problem at the moment is that people have been observing the measures in a rather variable, patchy way. And I think it's quite understandable that some parts of the population by now are really quite fed up with observing all these precautions when maybe they don't actually personally know anyone who'd had very bad COVID. I would just emphasize how important it is at this moment. I mean, in the UK, the hospital beds are really filling up, especially in the affected areas. Now something like 60% of the cases that we're seeing in London are this new variant. So we know that it is capable of causing quite severe disease and causing hospitalizations, and we're sure that this is going to lead to a number of deaths. What we don't know is just how severe it is in general, whether there's a lot of cases out there in the community, maybe in younger people who may not actually have any symptoms at all, but maybe spreading this new variant, which seems to bind even better to the receptors in the nose and in the lung.
Yeah, no, and there has been some concern that this new strain might affect the immune system's response to the vaccine. That is to say that the vaccine may not work in response to this strain. Can you explain why that might be?
So normally when the immune system sizes up a protein, it responds to a number of different sites on it. It identifies different places on the molecule that it can bind to, that it can recognize. And typically there might be, 5 or 6 different distinct binding sites on the surface of the protein. So the mutations that have been identified do affect some of those binding sites, but not all of them. And it seems quite likely, I would say, speaking as an immunologist, that the mixed immune response that you have to either the vaccine or to the natural infection is going to generate enough cross-reactive immunity that the vaccines will still work, and people who've been infected are less likely to be infected or to have severe disease if they then get infected by this new variant strain. Oh. So, I think it is at the moment essential that we wait for the science. All of this is being tested in laboratories. People are working day and night, including all through the Christmas period, in order to get the answers that we need. It would be premature to say anything too much about that at present.
Certainly. And just before I let you go, I want to ask you just one final thing. A scientist advising the British government has said today that this mutation is likely to become the dominant strain globally. Do you agree? And how concerned should we perhaps be about that?
Yes, we know that these viruses do spread very well, and that, looking back in history, we can see that with many other viral diseases, a new highly transmissible variant will wipe out all the other variants. The viruses compete between each other for which one can transmit best, and it doesn't take that long for them to get all around the world. these days.
All right. Peter Openshaw from Imperial College London, thank you very much indeed for sharing your time and your expertise on France 24.
Thank you.